Back, a Hall of Fame quarterback gave a major medical update recently. Green Bay Packers legend Brett Favre announced he's been diagnosed with Parkinson's disease. Here to speak more about the disease and doctors Kavya Moravani and Joshua Chisholm, who both work in the Illinois Neurological Institute at OSF HealthCare. Good morning, guys.
Hi.
Good morning.
So could you guys just tell us more about Parkinson's disease and what that looks like for people?
So for patients, it means that they're going to have a condition that is going to impact their mobility quite a bit. Among other things, there could be memory changes as well. And for families, it means that their loved one is dealing with a slowly progressive condition, which will require them to provide physical assistance and emotional support as it progresses.
Got you. So, Joshua, Brett Favre is he just turned 55, and typically we see that this affects people that are like 60 or older, but 55 is a little bit younger. So, what does that mean? Is this common, for 55-year-olds?
I wouldn't say it's common, but it's not unheard of. In fact, you can get Parkinson's much younger than that. But it just means that he will have longer to struggle with it.
Right.
Parkinson's disease is not a rapidly progressive disease. It's slow. Life expectancy is pretty close to normal. And the younger you get it, though, the longer you struggle with it. And it does tend to be a little different.
Okay. So, doctor, what does treatment look like for Parkinson's disease?
So there's medical management that you can do with different medications. The mainstay is levodopa, and then there are other classes of medications that you can use. Dopamine agonists, MAOB inhibitors are the other common classes.
Okay.
And then there is surgical management as well, like deep brain stimulation and MRI-guided focused ultrasound, which are used widely. It is important to remember that none of these provide a cure or modify the disease in any way, and are basically for symptom management only.
Okay.
The only thing that helps with somewhat delaying disease progression or slowing it down further is aerobic exercise. There's a lot of data proving that.
Okay, that's good. So Dr. Chisholm, Favre's medical team told him they're currently looking at head trauma stemming from his football career. How do head injuries and concussions have a connection with Parkinson's disease?
So the condition that's caused by repeated head trauma, we actually call something else, either traumatic encephalopathy syndrome or chronic traumatic encephalopathy, and it actually has different changes in the brain. I wouldn't say that someone has Parkinson's disease and chronic traumatic encephalopathy. You usually have one or the other. And so the changes in the brain that happen with Parkinson's disease are in fact different from the changes in the brain that happen from repeated head injury. But in looking to diagnose the traumatic encephalopathy syndrome, they do look for Parkinson's signs sometimes, and also cognitive decline. But in Parkinson's disease, we're really looking at three factors in our exam, and it is a clinical diagnosis, meaning it's made by your physician. And those are bradykinesia, which is like a certain slowness of movement, rigidity, and resting tremor. We look for all those to find the symptoms of Parkinson's disease, which we call Parkinsonism. And there are multiple causes of that. And repeated brain injury, repeated TBIs, traumatic encephalopathy syndrome can contribute to the symptoms of Parkinson's disease, just like a stroke could. But that doesn't mean you have Parkinson's disease itself. So it's important to separate those two things.
All right. And lastly, Dr. Moravani, what are some resources that OSF has for people that have Parkinson's disease?
So nationwide, I think the most popular ones are the American Parkinson's Disease Association, Michael J. Fox Foundation, and the Parkinson's Foundation, and these resources can be found online. And locally, we have the Central Illinois Parkinson's Disease Support Group, which has been pretty active in getting these patients and their families together and sort of form a community and help them.
All right, well, thank you guys so much for joining us this morning. We'll share this entire interview on our website at 25minutesnow.com. We'll be right back.